Because when you're in a hurry, or you're doing cardiovascular surgery, or you're tying in a chest tube, and the nurse anesthetists are pulling the drapes down, and they're telling you to hurry, this is kind of the faster knot. This is the smart-ass knot. And that's what I'm saying. Dr. Kirkland would not allow us to tie this knot over at university. Now, most of my surgeons tied it, and they would tell you that there was really no room for a two-handed knot. But it's not as precise. And as we learn it, as we get over the pig lab, not today, but as we learn it over in the pig lab, you'll come to understand why it's quite not as precise. In other words, if I had to tie that, if I was helping the doctor at Princeton and he told me to put my first throw in, I would tie a two-handed knot, put my first throw down. When he pulled that cannula out, I would cinch down on my throw, and then I would come up and put my next throw as a two-handed because I got more control. And then what would I do? I want to finish out, I want to put about 6 or 7 more throws in there, do it one-handed, like that, and be done. So what do we do on a two-handed? One-handed. Same thing. There's your suture. So with me, again, I tie right-handed. I am right-handed, and this is one-handed tie. So I'll use this hand. I'm going to cross. And what we're going to do is now, instead of coming up and being like this, we're going to take this between our fingers like that, and we're just going to lay it over our hand like that, and we're going to bend that forefinger. Everybody got it? Some students in the past have called this what they call a hockey stick. I don't know where they get a hockey stick out of that, but maybe like that. It's a hockey stick. But so I'd say that, okay, that's the hockey stick. And what I'm going to do is I'm going to take my suture like that, lay it over my hand. I'm going to take my left string, put it between my first and second finger. I'm going to take my second finger over the string and under the other string, and I'm going to do that. I live for 365 days to see y'all's reaction. And that's all you do. Now you see why it's I can't say this because he's YouTubing this. So see why this is considered. Is considered a smart ass knot? Because it's kind of smart ass deal. Yeah, I can do that. Look at that. Look how fast you can. Yeah. Yeah. So that's the first throw. Remember, we got to do 2 throws. We got to do the square knot. So what we got to do is put the granny knot in first. So what we're going to do, and I'll go really slow this time. Take our strings, we cross. We put our, like that. Got my fingers out, I'm waving at you. Hey, how are you doing? And then I just do that. Okay? Then I'm going to take my left string, bring it between my first and second finger in that little crux right there. Now see what I've created there? Now notice, I don't have this suture back here. I can't do it back here if it's way back there. I got to have it at the tip of my fingers. So that when I lay that across and I bring this over there, what I've got is a little gap between this string and that string. Does everybody see that little gap? That's where this middle finger is going to go. It's going to cross over this string, under that string, and you're going to grab with your second and third finger, you're going to grab that string and let go, and you're just going to pull it through.
Sweet.
It is sweet, isn't it?
It is.
You're going to put one down, come back up, you're going to do the same thing. You're going to put down your next one. Now, that was the easy throw. Now we're going to do the hard throw. This is the one that everybody gets. And this is the one where I even, Mr. Harrelson has his way of doing it. He calls it a C thing, all kinds of different ways. What you're going to do is you're going to pick it up kind of like you're going to do the two-handed, only this time you're going to create a little bridge. See my little bridge there? I'm going to wrap that around my thumb, and I'm going to lift that up with my finger. Everybody got it? You're going to take this string, and you're going to go and make a cross over your forefinger. With your forefinger, you're going to wrap it around the purple, under the white, and then on top of the white, like that. And you're going to pull it through that loop right there. So this is what you're going to do, like that.
Just summon my
So you're going to go one, you're going to go two. One, two. I do. This is what I live for. So now I've got to. I got another class coming. So I'll get
relive the joy all
yeah,
over
but
again.
by this time tomorrow I'll be depressed.
No, you won't. We can come to your office.
Yeah, we just learned about that.
No, you don't understand.
Just ask us over
To see 30 people look at you going, whoa, that is just worth the whole year. So let's go back and do it again. We're going to cross our strings, lay it across the hockey stick, whatever that is, the hockey puck stick, whatever. We're gonna bring this around in between the first and second finger. We're gonna take our second finger, it's gonna go over and under and grab. And then you're just gonna pull it through the loop. That's it. Then you're gonna come up, you're gonna create your little bridge. See my little bridge there? You're gonna cross over your forefinger. In other words, you got the little cross. With the forefinger, you're gonna reach around and see how I rotated my wrist? See why you went into a surgical program? It's all about the wrist. You rotate around, you're gonna grab it and pull it through. Now, that's the student way to do it. The best way to do it is to take this and just grab it like that and just make the little bridge like that. And the reason being is because I can promise you that y'all will be doing this. You'll be making your bridge like this. And what's going to happen is you're going to come around like that, and that finger, and you're going to be going like this, you're going to be going like this, and you're going to be chasing this thing all over the place. What I'm going to do is I'm going to come and grab your hand. And you're going, that's what I'm saying. Notice my hand never moves. It's all that finger. It's all about rotating right here. I'm not flaring out. I'm not smacking people in the sides. I'm not doing anything. I'm just doing that. And I just rotate around. So what you can do is once you kind of do this one or two times and realize that it's really not the best way to do it, is just grab it between your finger and thumb and just push it, your thumb and second finger, and kind of make that little bridge right there. And then just put it right there and see how I'm using my thumb to kind of lower it down to grab it and pulling it through. The key here is that you'll see some surgeons who will go ahead and pull it through like that. That's okay. That's the way I did it. But actually, Mr. Harrelson, when I got here, he taught me how to do this and then rotate my hand over and grab it. I've been doing this 25 years. And not saying I was wrong. I just feel like it's a better method to just rotate and grab it. Y'all ready to go practice? You want to see it again?
One more time. Help me.
Grant me patience.
It's like those old rubber band tricks you used to do. Where you,
Oh,
stick
yeah.
fingers
Yeah,
in.
yeah.
You do like the Eiffel
Yeah.
Tower and like
Stick your hand in there.
whiskers. Yeah. I used to be really good at that, so
Yeah.
that's what I was hoping.
Got the string, we cross. Grab 'em like that, and I'm waving at people. Hey, how you doing? Gonna just put it across like that, bring it around. Second finger is gonna go over, under, and grab. And then it's gonna rotate, whoops, sorry. Then it's gonna rotate through. You're gonna come back up. You're gonna make your bridge. You go over like that. With forefinger, forefinger's gonna come around, come and grab that and bring it through. Once you get here, you don't drop it, because if you drop it, it'll just fall apart. What you're gonna do is you're gonna come around, you're gonna rotate your wrist around like that, and you're gonna grab it between your thumb and first finger and bring it down. And that's why we do this. Look how fast that is. And see, you can do it with your left hand, you can do it with your right hand. And remember, just to mix y'all up a lot, anything you do with your right hand, the way I told you about your strings, is completely the opposite to the left hand. So if I theoretically wanted to create, what I was telling you, put the first two throws in the same, and then the third throw is what gives you a square knot. Everybody understand that? Okay, because you're going in the opposite direction, you're left over right, right over left. Well, theoretically, and this is really going to blow your mind, theoretically, all I got to do is change hands to do the same thing. So theoretically, if I go in my right hand, if I do this and this to create my square knot, instead of doing this, which is, would create the square knot, all I got to do is this one with my left hand, and it's the same thing. Yeah, that kind of makes your eyebrows go up, doesn't it? Like, whoa, what did he just say? But you think it. You go home and think about it.
Well, because you have to do
that was easier for you. Do you prefer?
I never